So sleep apnea is actually a pretty broad term. It's two different things. So you have central sleep apnea and then you have obstructive sleep apnea. So central sleep apnea is basically where your brain tells your lungs to breathe, but they're not. So that's one form of it. The second form is when your brain tells your lungs to breathe and your lungs do it, but there's something in the way. Analogy would be this. So you have a vacuum, it's sucking. When you kink the hose, what happens to the suction? It goes down. So that's essentially what your lungs are doing. So when your lungs expand, they're pulling in the air through your nose, through your mouth, into your larynx, into your windpipe, and into your lungs. Well, what obstructive sleep apnea is when something in the nose, the back of the throat, somewhere even close to the larynx causes that kink. That kink decreases the amount of air that can go in, which leads to decreased oxygenation at night. It can raise your heart rate. And then what really ends up happening is over a long period of time, there's different hormonal changes. Some of those hormonal changes end up causing thyroid issues. They will cause issues with your heart, such as increasing your blood pressure, increasing your risk for coronary artery disease. With the release of cortisol specifically, whenever you have these obstructive episodes, it increases your insulin resistance. And what is insulin resistance? In a nutshell, it's diabetes. So having underlying obstructive sleep apnea will increase your risk of diabetes, stroke, heart disease. Being able to know that you have it and then what the next step is as far as treating it is extremely important. Most people's symptoms of sleep apnea typically are nondescript. They'll say, I'm tired all the time. Your wife or your husband will tell you, you snore really loud. There are some people who feel like they wake up in the middle of the night too many times, and sometimes when they do that, they wake up with what we would describe as choking episodes. And then there's other people who don't really have those symptoms, but their symptoms are high blood pressure, coronary artery disease, and diabetes. If you think that you have sleep apnea, the first thing to do is call us, make an appointment, and we will discuss things with you. We'll go through your history. We'll see, do you have hypertension, coronary artery disease, diabetes? Do you have these episodes at night? Has somebody told you have these episodes? We discuss things with you, and from there we can make a plan.